Members of Access Dorset have been given an opportunity to look into changes occurring in health and social care. There is a recognition that patients should have more control, and we want to find out what that really means, how it will work, and what help is available for patients in Dorset. We've already learnt from our first film that managing our own health conditions will need to be done in partnership with health professionals. So in an ideal world, we would receive good quality local services that communicate with each other and coordinate the care we receive. So how well is that happening now?
No,
They don't.
rubbish. We've had a bit of experience there, so.
From my experience, I think they coordinate fine, but from other experiences that I've heard from people, not all the time, is information relayed between services.
That's probably the biggest flaw in the NHS is communication, but obviously there's ways and means of trying to get around it. I think it's just really important for people to all work together, which obviously doesn't always happen, and people do slip through the loopholes quite often, which is a bit upsetting really.
I think it's getting better, but it's still not there.
I think sometimes, although obviously that's fantastic is what they do, it's kind of up to the patient to have to prompt your history, remind them of where you came from or you know, what's going on, what's happened. And I think the most unnerving thing for a patient, especially if going into hospital, is when you're asked, so why are you here?
We all have different experiences and opinions about the way services coordinate our care. Margaret is part of the lipedema and lymphedema support group, and in her experience, things have not been joined up.
The left hand doesn't talk to the right hand in terms of the medical profession. So the hospitals don't talk to the GPs. And when you talk to anybody, you're a patient or a voluntary organisation, and you get the feeling sometimes that you're not important.
It's not all doom and gloom, as Access Dorset assistant journalist Pat tells me.
A couple of weeks ago, I had an echocardiogram because I've got a heart defect. And what happened next was, as soon as they got the results, they wrote a letter to my GP. The next day, I had a phone call from the GP saying that they needed to increase one of my bits of medication. So I thought that was brilliant. The next thing that happened, a prescription was written out by the GP, sent immediately to the chemist. I collected it the same day. So when you think about that as an experience, there's 3, 4, quite a few people involved in that. It was like a triangle, really.
The one thing these examples show us is that there is inequality in the care we receive, and we know that many patients are frequently having to retell their health stories to professionals. In Dorset, work is being done on a project hoping to address this by coordinating all the healthcare providers. The project is called the Better Together programme, and Sally Sandcraft from Dorset CCG explained what it was all about. Can you tell us about how the programme's going to improve the experience for people?
Yes, we've been working for some time now with local staff across the health and social care sector, but also in the third and voluntary sector, to look at how we can improve services for local people. It's well recognised the frustration that people have around telling their story over and over to different health and social care professionals. So one of the key aims of bringing together district nurses, GPs, social workers and care managers into a single team to support individuals is that they will have one assessment, they will have care plans that are shared amongst the multidisciplinary team, so they don't have to keep repeating their story to different people within the multidisciplinary team, that they'll just be able to tell them once and that information with their permission will be shared.
Could you just explain what a multidisciplinary team is?
The multidisciplinary teams are those people that are working in the community. They are the person's GP, the district nurse, the social worker and care manager. There may be some specialist nurses that come into the multidisciplinary team to support the individual depending on what their needs are. So that might be a palliative care nurse specialist. The community matron is part of that team. So it's those people that work out in supporting people in their own homes, out in community settings. Our real ambition is that people only need to tell their story once.
Does that mean a patient's care is being coordinated by just one person?
Each person that requires the care and support of the multidisciplinary team will have a care coordinator that could be a district nurse, it could be the social worker, and that person will be known to the person requiring support. They'll be able to contact them if they've got any concerns. That person will ensure that their care is coordinated, that the care that they require is received by the different agencies, and they will take ownership to ensure that that person has a key point of contact and that all the different support that that person requires is coordinated in an effective way. We don't expect all of our health and social care services to have one system. That is unlikely, and we don't think that's very practical, but there are technological solutions where you can share information through an integrated platform with protections around passwords that enable those health and social care staff, with the person's consent, to access a summary care record for that individual. So we're looking at how we can bring those systems together so we can share that information through a technological platform.
The Better Together programme that Sally was talking about is in its early stages. But I met Lorna, a patient in Christchurch who's been taking part in a similar pilot scheme called the Virtual Ward. Like the Better Together programme, this scheme coordinates a multidisciplinary team to provide care and support in her home.
It could have been designed for me, and I'm so grateful to everyone concerned because they make my life so much easier.
Tell us about the support you've had being part of the Virtual Ward.
Oh, a lot of support. All the district nurses, and there are many, and they've all been extremely good and come up with what's been needed as quickly as they can. And then I have the GP comes. If I want him, he will come. He wanted me to see the consultant. I got an appointment for the following lunchtime. And I thought to myself, if I were not in this virtual ward, if I were ordinary, there'd be a 3 months wait to see the consultant. And this was the next day.
And you've had a visit from the pharmacist at home as well,
She came, Helen came, yeah. She helped me out. She does all my stuff in big black print, so I can try and see it. She actually came down, helped me to sort out my tablets in situ.
So you've got contact with lots of people giving you help and support. What difference does that make to your life?
Indeed. It means that it's a life, not just an existence. And I was quite pleased that there is this weekly meeting where I'm discussed as a patient.
But with all the support you're getting at the moment, do you feel able to live at home independently?
Oh, indeed, yes. And I prefer to be on my own, living at home. I couldn't bear to live in an old folks' home with other people all the time.
And you feel supported enough to do that?
Oh, yes.
We don't think we're going to get good quality healthcare unless services work together, communicating well and coordinating the care we receive at home and in our local communities. There is already some good things happening locally and a recognition that more needs to be done so that everyone can receive good quality care.